For over 25 years, QPI Healthcare Services has been committed to helping providers navigate the complexities of accreditation, compliance, and business operations in the DME industry. Since 2015, we have assisted hundreds of durable medical equipment providers across the United States, helping them establish and operate compliant, accredited, and successful businesses. The DME industry can be complex and high-risk. Over the past decade, some providers assisted by QPI were later implicated in healthcare fraud, and we believe it is crucial to share a few of these cases with you, to highlight the risks and ensure you are fully informed. QPI and its employees did not participate in the day-to-day operations or have access to financial records or billing activities. We will be educating you on how to ensure compliance integrity while expanding your DME business. At QPI, we remain committed to integrity, compliance, and excellence. Let us guide you through the complexities of accreditation, credentialing, and risk management so you can build a stronger, more compliant, and successful DME business. Next, we are going to discuss fraud charges versus restitution amount. When the government prosecutes healthcare fraud, they base the charges on the total amount billed to government healthcare programs, such as Medicare and Medicaid. However, restitution is calculated based on the actual payments received, not the inflated amounts billed. Many fraudulent claims were submitted at rates 100 to 200% over the approved fee schedule, but Medicare only reimburses providers based on predetermined rates. How does this work? To illustrate this, imagine a provider who submits a claim for $1,000, but Medicare's fee schedule only allows $400 for that service. If Medicare processes and pays the $400, the fraud amount charged may be $1,000, but the restitution, the amount actually recovered, would be closer to $400. This is why, in fraud cases, the amount someone is charged with is often significantly higher than what they are required to pay back. For your review, we have attached the 3 indictment cases we will be referencing. Indictment of Mindy Brightman, healthcare fraud conviction. Billing for orthotic braces, and owning multiple DME companies. Brightman, a DME biller with over 25 years of experience, was convicted of conspiracy to commit healthcare fraud for her role in fraudulent billing schemes. Between January 2017 and March 2021, Brightman engaged in fraudulent billing practices related to orthotic braces, used illegal marketing tactics to obtain Medicare patient referrals, submitted approximately $30 million in fraudulent claims to Medicare. The legal consequences of her action was a sentence of 72 months imprisonment, 3 years of supervised release, and a restitution order of $7,700,000. This case underscores the severe legal penalties associated with fraudulent billing, improper marketing practices, and noncompliance in the DME industry. To protect your business, it is critical to adhere to compliance guidelines, implement ethical billing practices, and ensure transparency in all operational activities. Indictment of Gabriel and Natalia Georgescu. Over a 17-month period, the Georgescus engaged in a fraudulent scheme involving illegal kickbacks and Medicare fraud related to orthotic brace orders. The Georgescus were paid by Medicare approximately $7.8 million in illegal kickbacks and bribes to marketing companies. In return, these marketing companies provided them with ready-to-bill doctors' orders for orthotic braces for Medicare beneficiaries. Using these fraudulent orders, the Georgescus billed Medicare approximately $30 million for orthotic brace claims during this same period. Legal consequences. Natalia Georgescu was sentenced to 6 months home confinement and 3 years supervised release. Gabriel Georgescu was sentenced to 6 months in prison, 6 months of home confinement, and 3 years of supervised release. Restitution was set at $7.4 million. This case underscores the serious consequences of engaging in fraudulent billing and illegal marketing practices. Compliance with anti-kickback laws, proper billing procedures, and ethical marketing relationships is crucial to safeguarding your business and avoiding severe legal repercussions. Indictment of Ken Pitter's $120 million Medicare fraud scheme involving straw ownership networks and telehealth fraud. Ken Pitter, a certified public accountant, expanded into the healthcare sector by orchestrating a straw ownership network consisting of 20 independent DME companies, a telehealth company, and multiple marketing firms. This vast network was used to submit fraudulent Medicare claims exceeding $120 million for unnecessary orthotic braces through telemedicine referrals. QPI was contracted to complete Medicare and accreditation applications for some of these entities. QPI had no involvement in their operations, financial activities, or fraudulent billing, and did not receive any fraudulent funds. However, due to its role in the application process, QPI was implicated as a co-conspirator in the case. Ken Pitter pleaded guilty to conspiracy to commit healthcare fraud and wire fraud and was sentenced to 72 months imprisonment, 3 years of supervised release and restitution of over $34 million. This case highlights the critical importance of due diligence when engaging in business relationships within the DME and healthcare industry. Even indirect involvement in application processes can result in legal scrutiny if fraudulent activities occur downstream. Businesses must implement strict compliance measures, thoroughly vet partners, and ensure transparency to avoid potential liability.